Deborah Poland,
Here.
Sheldon Taubman,
Here.
Elisa Neira, Maria Santos, Jacqueline Sanchez.
Here.
Thank you. And Gerald O'Sullivan, a subject matter expert. Thank you. We do have a quorum, Mr. Chair.
Thank you very much. And I will just note Wendy Fuchs said hello in the chat. She's here for on behalf of Ms. Nera. Will be able to participate in discussions, but won't be able to vote on matters today. Martin, do we have any public comment this morning?
We do not, Mr. Chair, but I think at this time you may want to ask the senior leadership team from Access Health CT to introduce themselves.
You're right. Thank you for that reminder. I apologize for skipping over those folks. James, do you want to say hello and introduce your staff or have them introduce themselves?
Absolutely. Good morning, all. James Michelle, Access Health Connecticut. And we'll start with Gina if Gina is on. If not, we'll go to Holly.
Good morning, everyone. Holly Zwick, Director of Finance, Access Health CT.
Hi, good morning, all. Rebecca McClear, Director of Technical Operations and Analytics, Access Health CT.
Good morning, all. Susan Rich-By, Director of Legal and Governmental Affairs, Access Health CT.
Good morning, everyone. This is Glenn Jurgen, Director of Human Resources, Access Health CT.
Good morning, everyone. Tammy Hendricks, Director of Health Equity and Outreach, Access Health CT.
Then we have Karen Perez. Karen, you want to introduce yourself?
Hi, good morning, Karen Perez. Sorry, I wasn't expecting. Manager for Health Equity and Outreach.
Thank you. Okay, Mr. Chairman, I think this concludes the Access Health staff that are present for this meeting.
Okay. Thank you very much and welcome everybody. Martin, there was no public comment, correct?
That's correct, Mr. Chair.
So we can move to review and approval of the minutes of the January 23rd, 2025 meeting. I'll entertain a motion to approve those minutes.
This is Deb Poland, so moved.
Moved by Deb. Do I have a second? I will go ahead and second that. And Martin, can we have a roll call vote? First of all, any comments or discussion on the motion? Hearing none, we'll take a roll call vote.
Sean King?
Yes.
Deborah Poland?
Yes.
Sheldon Taubman?
Yes.
Elisa Neira? Maria Santos? And Jacqueline Sanchez?
Yes.
Thank you.
Okay, it sounds like the motion carries unanimously, and that takes us to the next item on our agenda. Health Equity and Outreach Department update, followed by a Broker Academy update, and I will turn the floor over to Tammy Hendricks. Good morning, Tammy.
Good morning. Thank you so much. Good morning, everyone. Tammy Hendricks, Director of Health Equity and Outreach. We have some really exciting news. We are expanding our outreach team by hiring 4 new mobile enrollment specialists. And these are going to be team members that are going to be out in the field offering consistent in-person enrollment support to communities throughout the state. So we're really excited about that. Now, in the past, we've relied heavily on temporary staff, but now shifting to full-time staff is going to provide even greater impact for our community partners and events that we attend. And we're really doing this because it's really important for us to build stronger relationships, build trust, and be more responsive to community needs and our community partner needs, and not just during open enrollment, but all year round. So this team will work side by side with our current outreach team, and they will go through the full training certification process as all of our staff does, so that they can enroll consumers directly. They can do follow-ups, and they will also support our operations team during the peak 1095 season. So we are really excited to have them. We are going to start the hiring process pretty soon. They will be assigned to high need areas, thinking about community partners, hospitals, local events, that we can have our outreach staff table, and then we can have enrollment staff there to enroll consumers on site. And it'll be great. They'll be flexible, and they'll be able to adjust their schedule on the fly, really serving the community's needs and shifting gears as needed. Another point I wanted to stress, you know, we've been thinking about hiring these folks for a while. The great thing is we are just reallocating dollars that we typically use for temporary staff to be able to hire this new team. So we are going to make even bigger impact without increasing our budget. So this plan, we put a lot of thought into it. It's been in the works for a while. We're excited to bring it to life, and our community partners have been asking for this kind of support. And so I'm happy to be able to deliver that with this new team. I'll pause here for any questions.
Just a quick question.
Yes.
Thank you. Are you looking to hire people who, at least maybe some of them will be bilingual, is my first question. And then also, how many people do you envision to be on this new mobile enrollment team?
So we are planning to hire 4, and bilingual is always a plus. My current team right now, half are bilingual. So that's always something that we look for when we hire. Folks that have lived experiences, that know the communities, and that are bilingual.
Thank you.
You're welcome.
Any other questions for Tammy on the mobile enrollment team? If not, Tammy, I'll let you carry on with your next update.
Okay. Moving on to Broker Academy. Quick update. We are going into year 4, full speed ahead. We've completed the interviews this week, and we had over 109 applicants. So we completed all of those interviews, and we will be sending out acceptance letters later on today, actually. With the application process, like past years, we extended the deadline just a little bit into April to accommodate for those last minute applicants. And there's a really great backstory to that. In our very first year, the last applicant to come in is now one of our highest producing brokers. So we've learned to always leave room for the great talent that comes in right at the end. So again, this year we officially closed the application with actually 111 applicants. There were 2 applications that kind of flew under the radar. We did exceed last year's total, which is always exciting to see the program continue to grow. And you can see the web traffic data really surged in March due to the applications being open. Breaking down the applications submitted by the end of the deadline, applicants came in from 45 different towns across Connecticut. The majority of applicants, about 61%, identified as female, which continues to be a strong trend in this program. And for the first time, we are seeing a slight shift in a majority, in the majority ethnic group, now 28% identifying as Hispanic or Latino, followed by African American applicants. So it's always interesting to see how the applicant population will shift year to year. As for logistics, we are thrilled to partner with CT Leads, who have generously offered their space in both Danbury and New Britain locations to us at no cost. We have Maria here, who is with CT Leads. She's on this committee. I don't think she's present today. So we really appreciate her continued partnership with us. Finally, the class days this year are scheduled for June 7th and 8th, so just one weekend in the 2 locations. We've really worked to improve the learning experience for the students this year. So they'll be getting more access to online learning resources through the portal, and they will even have access to instructors virtually during this time before the in-person class. So this will allow the students to come into the two-day class more prepared. And we've had long discussions with Kaplan, who is the training vendor for this program, and they also agreed going down to 2 days would be appropriate given the extra resources and virtual instructor time provided to the students during the month of May. So that's where we are with year 4. And I'll pause here for any questions.
Any questions for Tammy? Okay, just for me, just a quick comment. Thank you, Tammy, for that that update, and I enjoyed the highlighting that the candidate who kind of came in at the last minute and is now finding great success as a result of the program. So those personal stories are important, and we're happy to hear them. Thank you so much.
Thank you for your support. Thank you.
All right. Moving forward with the agenda, we'll turn the floor over to Susan, who's going to give us an update on the Connecticut Molina merger, as well as some information coming out of, at the federal level, the proposed rule on marketplace integrity and affordability. Susan, go ahead.
Thank you very much, Sean. Susan Rich-Bai, Director of Legal and Governmental Affairs. So just a brief update on the Connecticut Molina merger. As Sean mentioned, on February 1st, the transaction was finalized. So they now are the owner of Connecticut Holdings, Inc. And in our conversations with them, with Connecticut, they are going to be planning on continuing marketing under their Connecticut Benefits, Inc. and Connecticut Insurance Company, Inc. names and licenses for the foreseeable future. Those are very well-known brand names in Connecticut. Molina is new to the Connecticut market, so we're very interested to see how this works. They are planning on filing plans for 2026. The filing deadline is June 1st, so we haven't gotten the carriers' filings in yet. But once they come in, we'll know a little bit more. So any questions? Martin, you can move on to the next slide. Yep, thank you. So as most of you probably know, in March, HHS issued a proposed rule on marketplace integrity and affordability. It had a short comment period. It closed on April 11th. It was a 30-day comment period. And it proposes several changes across the market for exchanges and carriers. So this is pretty significant. The implementation dates in the proposal range. Some of them would be effective immediately. Some of them are effective for OE 2026. And I believe there might be one thing that was for 2027, but a lot of them were either immediately or for 2026. So they are proposing several changes to verification requirements, how we verify income. One of those would be under the Biden administration, the 90-day period to submit documents if there was a data inconsistency had an additional 60 days in the area of income added to it, totaling 150 days, which is quite a long period of time. So they are proposing to take away that extra 60 days and just have it go back to the 90 days. They are also talking about having exchanges verify at least 75% of their special enrollments. Access Health is actually in a good place here because we have been verifying special enrollments since 2016 or 2017, I believe. So we already do verify probably more than 75% of our special enrollments. So we're in very good shape there. They're also proposing to roll back some changes that the Biden administration had made on the failure to reconcile. So any consumer who receives a tax credit is required to file a tax return and file a form in 8962 to reconcile that tax credit to determine if perhaps the consumer is actually owed additional money by the federal government for the tax credit, or maybe they owe some money back because their actual income was different than what they estimated. Under the Biden administration, they had changed the requirement from exchanges withholding tax credits in a new year if the consumer had not filed for one prior year. The Biden administration had extended that to 2. That's only been in place for kind of a short period of time. This current rule is proposing to take it back to the 1 year. And they also are proposing to make a change that depending on the message that the exchange gets back, the electronic message from the IRS on income, if we don't get an actual income value, we either get an error code or no message. Under the Biden administration, we had been permitted to not open a verification in those instances. They want to roll it back to the previous date where we would have to open a verification. So all of this means there will be more income verifications going forward. And Access Health has a process in place on the failure to reconcile that does help consumers know if they do have an issue in a good way. So I don't know that any of these changes will be that significant, hopefully, to our consumers, but it does mean, some system changes that we will have to make. And there will be, some additional friction from that. They are also proposing to change the actuarial value ranges for plans, which could change premiums. Because we use standard plans, it won't really make a difference for our standard plan individuals. We haven't had a big number, Rebecca. I think it was maybe 200 individuals, somewhere around there. Some states, this is a much more significant impact. They're also proposing to shorten the open enrollment period from November 1st to December 15th and to not allow exchanges to extend it. Different states have had different rules in place. Some states, California, had their open enrollment period going to January 31st. So we'll see how that works out. They're also proposing changes for premium payment rules with issuers, and also, with the exchange requiring something that had been in place under the previous Trump administration, requiring a consumer to pay any past due premium before they could effectuate a plan in a new year. The prior rule only allowed a look back for 12 months. They're now talking about any past due premium that might be there to that carrier. They're also proposing to make changes to recent changes the previous administration had made on payment thresholds that the carriers may use, percentages or dollar amounts, and also a big change for any consumers that may have 100% APTC on their plan to require that APTC be changed so that the consumer has to pay at least $5 for the first month that they could then get back later. But so that their thinking is that this will help potentially eliminate any fraud that may be going on with enrollments. Also along those lines, changing rules to broker oversight for the FFM. The state exchanges have been in a very different place than the FFM for the recent news about potential broker fraud. The way we operate is different, and the way we have brokers verify their connection to consumers. APTC dollars could go towards those benefits. And then also making some changes to the premium adjustment percentage, which is kind of a technical thing, but it impacts employer contribution percentages and also can impact APTC amounts slightly too. So a lot of changes across the board. What we're hearing from some people is it's probably pretty likely that they will finalize nearly all of this or all of it, as they've proposed. So hopefully they will come out with the final rule in a short period of time so that we'll know what changes we need to make and so that we can also prepare consumers for these big changes that might be coming. So I'll pause if there's any questions.
Any questions for
I
Susan?
have a
Oh, go
I
ahead.
have a question about the DACA students. So that means they're all the ones that are enrolled are gonna be terminated as of December? Is that what it means?
I think they're going to be, they maybe have to be terminated immediately because they're talking about a change in the eligibility. So not that they couldn't enroll after that point through a SEP, but they may have to terminate, people may have to terminate, exchanges might have to terminate their coverage, mid-year. So we will see what they come out with. Yeah, it's pretty unfortunate.
Yeah. Thank you.
So if that does happen, obviously we'll do our best to, to work with these consumers
And is
try
that,
to help them.
Oh, sorry, Susan.
Sorry.
Is that's for anybody with a DACA status or just folks who are receiving financial assistance?
So DACA, the change that was made last year that was effective November 1st, granted eligibility to DACA recipients. They had to be a registered DACA recipient. So they were now newly eligible as lawfully present to enroll in coverage and eligible for financial assistance. So the change would be, unfortunately, in both areas.
And is there a plan or strategy in place to start notifying these folks about, I guess we don't want to alarm them too soon, but we also understand that this is likely to be implemented and they should have some sort of warning ahead of time. Do we have a strategy for that?
No, Sean, we normally don't do any communication until we have a final ruling. Frankly, at this point, we don't know what's going to happen. So we have not done any outreach at all. What we can do, we could communicate with the organization, the nonprofit, the community-based organizations that service, and let them know what's coming. But we normally do not send anything out warning anybody of what's coming because get people excited. If it doesn't materialize, then so we're concerned about that. But we will talk with the community organizations that many of our immigrant population go to for help and guidance, and let them know what's coming. And they could have those conversations. That we will do.
Yeah, I understand the challenge of like you said, not getting people misinformed if the rule doesn't go into place, but considering the immediacy that it will probably take effect, it's gonna there's that potential for surprise and panic and not being able to react quickly. So I guess any opportunity that we can to
one of my
support those
concerns,
folks.
Sean, is the whole point of this administration is to scare people.
Yeah.
And obviously, I'm a little concerned about being part of that process But I do want to send your point about making sure people is aware of what's coming. And that's why maybe one of the more effective ways to do that is I talk with the organizations that most of them go to for help and guidance. Then they could do that inform, but to send a letter out telling everybody, hey, you made us a coverage because the Trump administration may cut your benefits.
Okay.
But I don't know if that would be an efficient, effective, or politically correct way to go about doing this.
Yeah,
and Sean, so thank you. Sorry, James. Sorry, thanks, James. Rebecca pulled up the information. Currently, we have 118 enrollees who enrolled through the new eligibility for DACA recipients. So
okay.
It's not a huge number, but obviously for those people, it's very important.
Sure. And I will just offer from our office, the Office of the Healthcare Advocate, that we would be happy to partner on some messaging that maybe we can put out through our website and our folks to help
Okay.
support that
Yeah.
transition.
Yeah, we'll follow up with you and
Great.
others as well. Thank you.
Okay. I see that Sheldon raised his hand. Go ahead, Sheldon.
Thanks. A question about, hopefully this isn't going to happen, but if it does happen, which seems under the circumstances likely, what is the plan, if there is one yet, for due process in terms of advance notice, how much time, and of course, the more time, the more addressing the issue just raised by Sean, it'd be helpful. But, there's always the possibility. Due process is about giving people an opportunity in case they think there's a mistake. And there could be people who got on coverage and with subsidies as DACA, but their status has since changed. So they actually have, they're in a new category that makes them eligible regardless of DACA. And so that notice has to tell people that if they think there's a mistake, that they're still eligible. This is the hearings process. So has there been any thought about that at this point?
So we do. So if this does go into place, we would rerun the eligibility for those people. And to your point, Sheldon, anyone who had a newly attained lawful presence status, that would show up during that check. So that would go into place. And for anyone who did not have any updated status, that might make them lawfully present, they would get the notice that normally goes out in an eligibility determination that does have all of that information about our appeals process and the appeals form and all of that. So all of that would go to consumers in that case as well.
Right. And I was asking about how much time were you, how far in advance of the actual termination date would the notices go out?
Yeah.
We have to find out when, we don't know when this is going to be, implemented and how we'll need to run that. So we'll know more, if and when that portion of the rule is finalized.
Right. I guess what I was saying is that regardless of what the rule says, there is a constitutional due process right here, and you have to give adequate notice no matter what the feds say. You can't just terminate somebody with 5 days notice, for example. So that's just, and bottom line is you don't have answers yet on this.
Yeah. And we'll follow, obviously, I think exchange rules may be a little bit different than Medicaid rules for terminations and things. We would have, obviously we would follow all of those rules for notice. So.
Thank you.
Thank you.
Well.
I saw Maria, you had your hand up before. Maybe your question was answered already.
It was answered, yeah. It's I guess we're on the same page. Don't know timing, because I was worried about the same as my questions were the same as Sheldon's question. Okay, what if somebody has an appointment already to be seen in 2 months? And you know how appointments go. You have something, but you call your doctor and they can't see you until 60 days from now. What's going to happen with the people that already has appointments and all that? If all of that can be taken into consideration when deciding when they're going to be terminated, or people that already has, services that are current and all of that, timing is important. So hopefully they allow them to go, not to terminate them just 2 weeks, but at least months, 6 weeks, I don't know, 60 days, something like that, that they can get. Also, they can get their service, because I know a lot of people that this is the first time they have insurance, since they've been here, because that was awesome that they were able to do that. People that been here for years, and now they were able to go to doctor, go to dentist, do all that. What's going to happen to those bills? I mean, it's are they going to get the bills now if services were done while they had the DACA insurance? I mean, that's a lot of questions, but I guess we don't have the answer to that.
Yeah, well, and anything that was any expenses they incurred, up until a time when their coverage might be terminated, obviously would be treated as covered, you know, under the, if it's a covered service, you know, it would go through the plan. They're not going to go back and say something you did in January couldn't, you know, you can't go back like that. But obviously, yeah, these are going to be a lot of things. And James's point, you know, some of the area where I think these community serving organizations, you know, can be really helpful, and OHA, you know, maybe Gerard, the insurance department as well, you know, for all of us just to help out as well as we can.
Thank you.
And that maybe you already said this part, but do we have any idea when this rule is going to be finalized?
We don't know the date. I'm guessing it could be fairly quickly. They do have an obligation to go through all the comments, whether or not they're going to act on them. They do have an obligation, and they received a very large number of comments. So, you know, I don't have a definitive date. I could see it maybe being a month because they seem to want to move on some of these things right away, but we just don't know.
Thank you.
So Deb, it's up to them, Deb. We just we're trying to, you know, we've been waiting for a while now to get this thing moving, and because we do have a communication strategy that we're developing. If some of these things do happen, and how we gonna connect with the communities, especially the impacted customers of ours, and how do we help them through this process? So we are waiting to start the process of helping these folks. We hope it does not happen, but if it does happen, we do have a plan in place to start communicating and do in-person events. As Tammy indicated earlier, we are adding more people to our team, so that we are better positioned to help address some of these challenges. And that's coming more and more frequent.
Thank you. And we're happy to partner with you as well.
Absolutely. Mr. Chairman, I have to drop off. I have another meeting, but Tammy's going to get my update towards the end of this. Something just popped up that I have to deal with.
Okay,
my
James.
apologies for that. Thank you.
All right, good to see you. Thank you.
Likewise. Thank you.
With that, then, if there's no other further questions, I think Susan's going to continue with the enhanced subsidy changes. Go ahead.
Yes, I can continue with this. So this is something that we have been working on for quite a while, and James and I have been really working on, and James has been out there speaking in all sorts of different forums to different stakeholders, elected officials, different carriers, different organizations. So for anyone that's watching, you know, has been sort of focusing on this, the enhanced subsidies that have been in place since 2021 that started under the American Rescue Plan Act and then were continued in 2022 under the Inflation Reduction Act are set in current legislation to expire at the end of this year, 2025. If that does happen, this will have a really significant impact. The subsidies, you know, APTCs aren't completely going away. So that's also, you know, a message that we want to convey to people, but it will have a substantial impact on the amount of financial assistance that people are eligible for. And for those consumers who have income over 400% of the federal poverty level, they would lose eligibility completely for subsidies. It would go back to the pre-2021 contribution percentages and rules. We are hearing that there definitely is interest among even Republican members of Congress in continuing these, because people do realize what a big hit inflation and everything else wise this would be for consumers for 2026. And interestingly, in Connecticut, we have our percentage of subsidized population increased greatly. It went from, in prior years, it was right around 70%, 68 to 70% of our population. And then once these enhanced subsidies went into place, we've had 90% of our population being eligible for financial assistance, which is great. In some non-expansion states that did not expand Medicaid eligibility, like Connecticut and many other states did, their subsidized populations are 98 and 99%. So in those states, it is a much bigger impact even than in a state like Connecticut. So we're doing everything we can, and we're keeping everybody apprised. Along those lines, we're also working and thinking about communication plans, because unfortunately, we just don't know the timing, if they will take action, and if they will, when the timing is, and how that's going to fall with the insurance department's rate approval cycle, which usually the finalized rates come out in September, and that's when all the notification goes to consumers. So we are working on a communication plan as well. Obviously, if they don't get continued, I think our primary message will be, that we have many options available, and to really encourage consumers to shop, to really work with a broker and really compare their options, because maybe switching to a different plan, might help them in that situation, to not just renew into the same plan that they may have been in for this year. But we'll keep you posted. We'll have more on that, but we're keeping, our focus on this, and we will keep the committee apprised. So I'll pause for any questions.
Any questions on that for Susan? Seeing none, thank you, Susan.
Thank you.
And we'll move forward with the next item on our agenda. Do we have Kristen Dowdy here for DSS update?
We do. Good afternoon, everyone.
Welcome, Kristen. Take it away.
Thank you. Well, thank you to the committee for inviting me to join you here today. I've been asked specifically to provide an update on the Husky A parents and caretaker relative transition. As many of you might recall, legislation called for us to reduce the Husky A income limit for parents and caretaker relatives in our Medicaid program. And those changes went into effect last October 1st of 2024. The income changes resulted in a reduction of the income limit previously at 160% of the federal poverty limit, being reduced to 138% of the federal poverty limit. So this did impact about 10,000 Husky A parents and caretaker relatives. Can advance. So where are they today? Many of you might be wondering. Our colleagues over at Access Health, Rebecca and her team, have graciously worked to provide a report that the department receives daily, so we can see at a moment's notice, where these enrollees are since the change was implemented. And right here, you can see that the majority of impacted enrollees have remained in the Husky Health program. The vast majority are in the Husky Transitional Medical Assistance Program. And this is because, they were enrolled in the Husky Parent Coverage at the income limit that now would make them, over income for that particular program. And so we are required to provide transitional medical assistance, which extends their Medicaid coverage for an additional 12 months. So you see there's over 7,500 enrollees that are in that program. In the course of working with all of these individuals, folks do, have provided updates to their income, for example, and other circumstances that impact their eligibility, and they may have transitioned to other Medicaid programs, perhaps reported a pregnancy or some other change. So you'll see those figures there. You'll see individuals who did move immediately to an advanced premium tax program, credit program, including covered CT, as some individuals who had unearned income were unable to move, into our TMA program and move directly to alternative coverages. And then you'll also see that about 9% or 978 individuals as of the 23rd, I think, when we pulled this particular report, are not covered through Access Health or not enrolled in TMA. So those folks could have, since enrolled in employer-sponsored insurance or other coverage that we're not aware of. So this report remains pretty static, I would say, on a daily and weekly basis. We do see fluctuations. We do see people moving around a little bit, but nothing substantial to really change the percentages of populations overall. But this report will become more helpful as we embark on the final transition of the folks in TMA to alternative forms of coverage, including covered CT, come next fall. You can advance, Marcia. Thank you. So what are we doing now to facilitate enrollment? So we have the subset population of those folks in the TMA program that transitioned because of the change. But there were folks who were already in the TMA program, and there are folks who are transitioning off to other coverage on a monthly basis. So like the individuals that were impacted in the fall, each individual receives, a notification of the change in their eligibility. They are notified if they no longer qualify for Husky Health. And at the same time, in the same notification or in that same telephone conversation they might be having with call center reps, they are notified of their eligibility for the covered CT program. So that real-time integration piece is very valuable. We have also improved our ability to help streamline the enrollment for those folks who do want to enroll in covered CT. Prior to a change that we recently made in our system, which allows them to automatically opt in, there were separate steps an individual would have to take once they found out that they would qualify for an advanced premium tax credit program, and it would require additional steps and additional time. So we were able to build into our application process, and including our online process, the ability for them to make those decisions in advance should they not qualify for Husky, so that we could seamlessly enroll them immediately, ensuring that there's no gap in coverage. And then also, we're taking steps. We were doing it in the fall after, the initial transition, and it is occurring routinely since then. Access Health is identifying individuals who do not qualify for Husky Health and have not enrolled in other coverage. So those types of outreach attempts are being made on a routine basis. You may advance. And working with specifically with Access Health and with the Office of Health Strategy, we are preparing outreach efforts for likely to be in the late summer or early fall. So there's been a lot of work that's been already underway over at OHS and with a smaller group of individuals. But in fact, next week, a larger group of us are convening. It will be Access Health, the department, and OHS partners who will be meeting to really try to coordinate our efforts and align our activities, working together as we prepare for that larger subset of individuals who will move from TMA to covered CT or alternative advanced premium tax credit programs. So right now, certainly things that are on our to-do list are making sure that we have a special notification mailing to impacted enrollees. We may choose to follow the successful experience we had with providing folks, heads up type notice during the unwinding period to make sure that they update their information, make sure that we can contact them, that we have the best information to reach out to them so that they don't miss any communications about any next steps that they might need to take. We plan to text message our impacted enrollees. Certainly we'll update our websites, share information between, through our community partner newsletters, social media messages, share information at community events. We're looking to leverage contracts that we have with Deb and her folks over at the Community Health Center Association of Connecticut, both DSS and OHS. Work very closely with Deb and her team, so we would like to take advantage of that. OHS has been involved in a direct marketing campaign using digital video and traditional media in multiple language and across various platforms. So we're, excited about using many of those materials and making sure that, we're able to share posters, flyers, enrollment guides, and other instructional content with both consumers and other partners, such as our brokers, our certified application counselors, and any community partner who will help spread the message. And with that, I will ask for any questions. You can advance. I think there's just one last slide, Marcin.
Do we have any questions for Kristen?
So people that don't qualify, that lose, thank you, Kristen, that was awesome. People that don't qualify, right, any longer for the Husky, they don't lose coverage in between one another, right? So they don't qualify for Husky, but they pass immediately to the new CT coverage, right? No, there is no gap in the middle. There is a gap. Is there a gap?
So it depends and generally speaking, no. So parents, caretaker relatives, and children, if they lose eligibility for those programs, they'll move into transitional medical assistance. With children, because of the implementation of continuous eligibility, their Medicaid coverage gets extended a little bit longer before the transitional medical assistance kicks in. And then when that period comes to an end, most children will move on to the CHIP program, depending, or the family might move to, for example, covered CT or an APTC. So it really depends on where they are. At the end of TMA, we do reassess eligibility. We ask for updated information. They will get a pre-filled renewal form. If they don't move into CHIP and the next step for them is covered CT and they have indicated they want auto enrollment, there would be no gap. But they do have to respond to that renewal so that they don't lose coverage in order for us to, take advantage of making sure that they have auto enrollment.
And that's the renewal that they get on the mail, right? So if they don't respond, so the family gets a letter, right, letting them know that they're losing a Husky, they're not eligible anymore, and now they need to select. They need to choose to be part of the other plan, the HCCT. But what happened if? What happened if the family doesn't speak the language, the family move, they're not in that address anymore, and then they go to the doctor, that the time already passed, they never received that piece of mail.
Mm-hmm.
What happened to that family? Then they lose coverage and they're...
It's possible that they would lose coverage. We're also trying to, if the change is occurring because they have gone through a renewal process, we are also text messaging folks. So they are getting some reminders. They get a second notice. Our outreach attempts are only as good as the information that we have, which I think is important when we convene to plan our outreach efforts for the late summer and fall, that we do, try to reach out to folks early, make sure that we have the most updated information so that we can avoid, folks not realizing that they need to take action, that they need to look out for that pre-filled renewal form. But we'd really like to we're required to, but I mean, it makes sense that that we have updated information, because it is possible that something has changed since they've been in the transitional medical assistance program, and perhaps income, has been reduced and they might qualify even for another Husky program again. So.
Yeah,
if I could ask for your assistance in helping to spread the word, to update information with the department, when things change, that's most helpful.
Yeah, anything that we can help with. And I ask because it has happened here that we have some parents. My name is Maria Matos, from those that doesn't know me, and I'm the vice president of LEAD, Latinos for Educational Advocacy and Diversity, and we have community centers in 7 cities in Connecticut. And we've been blessed to have met Essie and Karen and Tammy, and they have been using the centers to as a bridge connection with the community. I think kind of like very effective in a very effectively way. So we do open enrollments and some kind of other programs with Access Health. And when we have these cases, the families that get here and they said, "Oh, I went to the doctor and now they told me that I don't have coverage." And how long we haven't been there? Well, haven't been for like 2-3 months because I didn't need to. I went today with my child and they said that I don't have coverage. Then when we called, they said, "Oh, well, we sent you a letter." And they're like, I saw that. I didn't understand what it says. I put it away. I never responded. And then, it's like, okay, now we have to wait, but the child needs coverage. And thank God that sometimes, or most of the time, every time we have called, they have been able to like do retro and just cover that. Like we have to do the process because they're not able to do the process by themselves. They don't know what to do. Or sometimes they just go, and go to like any doctor, or either just go back to whatever country in origin they are just to get the services, just because they lost coverage and they think they can get it back. I would love to like see if we can brainstorm you guys you're using what you have, the resources, but you can also like, if we can talk about another ways, I don't want to say the best, but like another way, an extra way, more ways to communicate the families about losing this coverage, so they're not without coverage for 2-3 months without even knowing that they lost it. Or they're eligible for a new one or something like that.
Sure. Yeah, I'm happy to take your comments back to the group, and it's something that we can discuss as we plan our outreach efforts.
Thank you. Appreciate it. Thank you so much.
Any other questions or comments for Kristen?
Listen, I just want to make a comment. Thank you so much. DSS has been another really great partner for us, along with Access Health and OHS. I was interested to hear you say that you moved the question around, do you want to be considered for covered CT, to the beginning of the application? Because I've heard from several of our certified application counselors that they see that question and they immediately check no, because they think it means I want to get that instead of Husky or instead of a QHP. And so I will make sure that I push out information to them that says like, no, you should still check yes. And if the person's eligible for Husky, they'll get Husky.
Absolutely.
They were concerned that if they checked yes on that they wouldn't be considered for Husky.
Right. And you can't qualify actually for covered CT unless you don't qualify for Husky.
Right.
Yeah. So we would definitely encourage folks to complete that. That's really helpful feedback that we can make sure, that we share with others, because if your application counselors feel that way, there might be confusion elsewhere. Yeah. So that's very valuable. Thank you.
And I'll just interject really quickly here. Deb, we meet monthly with CACs. I really encourage you to tell your CACs to attend those monthly meetings. We cover a lot of this information. And not only that, they go through the certification process as well. So there's an opportunity here for us to really get, to the misinformation before it causes too much confusion. So we're happy to do more.
Some of them knew this information. It was just like, I heard that several times from people. So
yeah. So
I'll let them know about the monthly meetings though too.
Yeah, absolutely. Thank you so much.
Well, if that's it, I'll say thank you for inviting me. And I'd happy to join you guys again with other updates. Medicaid, a lot of changes are also kind of, waiting in the wings to see, what other federal changes might impact the Medicaid program as well. So I'm happy to keep you apprised of those changes as we learn of them.
Thank you so much, Kristen. We may, on that note, probably invite you back sooner than maybe we would like to, considering the nature of some of those changes. But appreciate your time today.
That's another discussion. Yes, thank
Right.
you.
Okay, our last agenda item, strategic initiatives. I think Tammy, were you filling in for James on this?
No,
I
I'm
think
back.
James
Oh,
is back.
he's
I'm
back.
back, Mr. Chairman.
All right.
My meeting ended very quickly. Just a couple of quick items. As you know, have heard from us. We have a program. We are currently will be deploying on July 1st for small businesses to give their employees access to the individual market, which is called ICHRA, individual coverage health reimbursement agreement. So that's coming, and I saw a demo of the platform yesterday by our vendor. That's coming. That's gonna come, and there we're gonna be targeting the small nonprofits across the state of Connecticut. We know that most of the employees would probably qualify for subsidized health insurance on the exchange. So so that's coming July 1st. And the other one also our call. So we have new call center contract with the same vendor that requires them to deploy some new technology for us. And that's going to be helpful. And new IVR is going to go in place on July 1st, leveraging AI, which should make it more efficient, more effective way of servicing our customers. As well as we are developing a new platform. Again, we don't have a target date yet, but we're about 18 to 24 months out to go live with a brand new platform, replacing what we all currently use now. We've been using the same platform since we went live back in 2013, with minimal changes to it at all. So structurally, we're still using the exact same process system that we've been using since we went live. So we are working on a new project we call 10 clicks. The goal is to get everything done with 10 clicks or less. It is a very ambitious goal, but that's our objective. And the intent here is to make it easier, faster, and more efficient to have folks enroll to apply for health insurance coverage, through Access Health, whether it be Medicaid or Husky or QHB or Cover Connecticut. So more to come on that. But again, we have the process laid out now, and we're going out to bid to hire a vendor to develop the platform for us later this late spring, early summer. So those are the three big items that we're working on, which we think all focus on helping Connecticut residents get more efficient, faster access to health insurance in the great state of Connecticut. That is it, Mr. Chairman.
Thank you, James. Appreciate that update. Do we have any questions or comments for James? All right, seeing none, we're right at the top of the next hour. So I will make sure that we try to end this right on time here and entertain a motion to adjourn.
So moved, Mr. Chair. Deb Poland.
Moved by Deb. Second, I'll second. And any discussion, we'll take a roll call vote. Marcin?
Sean King,
Yes.
Deb Poland,
Yes.
Cheryl Taubman,
Yes.
Lisa Maria Santos, Jacqueline Sanchez.
Yes.
Thank you.
All right, the motion carries. We are adjourned. Thank you, everybody. Good to
Thank
see you
you.
all until the next time.
Good to
Thank you
see
all.
you, Maria.
Thank you all.
Bye. Thank you. Good to
Bye-bye.
see you. Take care. Bye.
Take care, everybody.